I'm really excited to come and do a conference where everybody's coming and not paying anything. So I'm absolutely delighted to offer my services for this conference. Oh, it is working. Just what I'm going to do today very quickly is just to go over an introduction to myself. Just a couple of objectives for the presentation. Looking at what is CBT, looking at CBT and anxiety, but I'm going to do that from an overview in CBT and anxiety rather than picking something in particular. I'm going to pick a couple of things and look at some CBT treatment of anxiety, and I'm going to just very quickly go over a treatment plan, what we would consider a treatment plan for travel anxiety. I'm happy to take questions as they come up, happy to take questions from the room or wherever, so please interrupt me, I'm fine with that. I'm a Cognitive Behavioural Therapist. I'm BABCP accredited and UKCP registered. I've been involved in CBT training since about 2002. I'm a founding director of the Glasgow Cognitive Therapy Centre. We've been going for almost 2 years now. I am obviously also in private practice and take referrals from various sources. We do a lot of rehab work, people in car accidents, etc. I do some GP referrals, I do insurance referrals, private referrals, lots of different referral sources, and I work at different levels of severity. Objectives to my presentation this morning. At the end of the session, hopefully, you will have a general understanding of the way in which CBT treats anxiety, and also you'll have some tools and techniques for dealing with some of the specific aspects of anxiety that is identified in CBT. One of the main things that's important in CBT treatment is we have really the 4 stages. We're looking at assessment, and I'm sure that's pretty common to all modalities. We all have our way of assessing. Some of our assessment are very form-based, very scoring-based, tick box-based, which is different from some of the other modalities. From that assessment, we're moving into a case formulation stage. That's a shared understanding of how that client got to where they are just now. It's a dynamic formulation. It may change next week when we get the next set of information. So it's ongoing, a building of a formulation of this person's issue. From the assessment and the case formulation, we're looking for a treatment plan. What are we going to do with this person? So we have a written treatment plan, and it will often actually be numbered in stages. Again, as we get more information, sometimes that does have to change. And then we have an evaluation stage, or sometimes called a review stage, looking back and seeing what we've done, what objectives we've met, what goals that we've met, and what the next stages are. Sometimes people ask, what is cognitive? And we're really looking at how people think. It's not positive, happy, clappy, always think on the bright side of life type of work. It is about looking at the meaning that people create in situations. It's about the meanings that they put on their symptoms, in this case, anxiety symptoms. What do those symptoms actually mean to people? And what does the events in their lives mean to people? And we're interested in this case formulation aspect of how did they develop those beliefs about themselves, about others and about the world, and we're looking here, as I'm sure you recognise, as the Beck's cognitive triad. Basically, behavioural for us is about what people do and what people avoid doing. And the work is in helping them do something or helping them reduce something, and to avoid the avoidance, perhaps. It's often said, and CBT is criticised quite a lot, for ignoring people's pasts and only dealing with the present. Yes, CBT deals in the present. It's about the issue now and how can we help that person with that issue and move on. However, CBT does believe that the past can be examined if that helps the individual understand and change the way that they're thinking or behaving now. Now, that doesn't mean to say that we're going to spend an inordinate amount of time looking at childhood issues. However, it is to help and to give clients an understanding of why they're at where they're at just now. If childhood experiences have been such that a child has had to develop a certain cognitive map, a certain way of behaving, then good for them. That's absolutely brilliant, because that's how that child's kept themselves safe at that particular time. And I think that's really clever to be able to do that. So we would praise and acknowledge that at some point the behaviour that they're having now that they're finding unhelpful was in the past helpful for them. And that can really help people buy into the treatment, because you're giving some validation to the behaviour, and it's now that it's not helpful, not in the past. It's very important to a cognitive behavioural therapist that the aim of the therapy is to help people move on, but also to teach the individual skills, life skills, ways of thinking, doing things differently, so that they can then maintain their own psychological well-being. And then when something else happens that might send them back into their issue or back into their way of feeling, that they have some tools and techniques to help them with that. What we're talking about here is, I'm sure you all know, there's loads and loads and loads now of self-help manuals. So people can be looking at self books, self-help material online, all sorts of different materials that they can be using for self-help. And sometimes we do work with people with their own self-help material. But it's actually about